Underactive thyroid problems are also known as low thyroid problems. As these names imply, low thyroid problems result from the underproduction of thyroid hormones. The medical name for low thyroid is hypothyroidism. A hypoactive or underactive thyroid is often characterized by sluggishness or listlessness. Weight gain and irregular, infrequent menstruation in women are also typical. Hashimoto's thyroiditis is an autoimmune disorder in which the body attacks and damages thyroid tissue, leading to lower hormone production. Underactive thyroid problems are especially dangerous for newborns and infants because they can lead to mental retardation and stunted growth. In the United States, thyroid levels of infants is usually checked soon after birth. If levels are low, treatment begins immediately. Underactive thyroid problems can usually be diagnosed with a simple blood test. Causes of underactive thyroid or hypothyroidism include loss of tissue. When hypothyroidism is treated with radiation, tissue destruction may occur. Surgical removal of thyroid tissue can also cause hypothyroidism. Exposure to excessive amounts of iodine. These can be found in cold and sinus medicines, certain heart medications, or a number of contrast dyes given before some x-rays. Lithium. This drug is often used to treat manic depression, but one of its side effects may be underactive thyroid. Antithyroid antibodies. People who have diabetes, lupus, rheumatoid arthritis, and chronic hepatitis may have antibodies that cause decreased thyroid hormone production. Congenital factors. Hypothyroidism can appear at birth, but thanks to a nationwide infant screening program, it's usually diagnosed and treated quickly. Thyroid hormone production deficiencies. This condition usually results in a goiter, which is an enlargement of the thyroid gland itself. A goiter is often visible as swelling in the front of the neck. What are the symptoms of underactive thyroid? The body requires a certain level of thyroid hormone production to maintain energy levels. Therefore, as previously mentioned, fatigue, sluggishness, and a general lack of energy are typical symptoms of an underactive thyroid. Symptoms vary somewhat by age. Infants will experience constipation, poor feeding, excessive tiredness and irritability, possibly jaundice, which is a yellowing of the skin and eyes. Symptoms in adults could include overwhelming fatigue, unusual sensitivity to cold temperatures, difficult bowel movements and constipation, increased weight despite a lowered appetite, loss of hair and changes in hair texture, reduced cognitive and intellectual ability, a hoarse voice,